Hello everyone, I'm Dr. Loria. Today we're going to discuss a little more information about the release procedure. As you may know, the release procedure is part of the LEAP procedure. Now what does that mean? There are two procedures regarding LEAP. Now LEAP is just Loria's elongation and extension penile lengthening or procedure. Okay, so when we say LEAP, it's either the release treatment, the sleeve treatment, or both. Okay, now the release treatment is primarily for lengthening, erect lengthening. That's key. The sleeve is for flaccid lengthening, and on occasion it can get erect lengthening, but we'll talk about that on a separate video. Okay, we're going to focus on the release. Okay, a lot of patients ask, what are the results, how does it work, and all that. So let's first go through what a release is, okay, and we'll talk about the results and patients' questions and so forth that have occurred over the last year and a half. A release is something like this. Let me demonstrate with some gauze, and it's a simple demonstration, but it works. Assume that for a moment this was the pubic bone here, okay? If I were to put this gauze on here, this is like the penis that you see sticking out, okay? So that's visible, but yet it's attached here down below that you don't see, okay? What we want to do in regarding release and to get erect length is to carefully just take some of that penile shaft off of the pubic bone or the symphysis area, okay? If you notice now, this is visible. See how much longer that is? Usually we try to get a full inch. Okay, if we can get more, we try, but an inch is the goal. And you'll notice a couple things. Number one, if you have an erection, let's go back to what's normal. That's you normally, okay? If you have an erection, normally the penis will just go up like that. So the angulation is upward, okay? Now that we've removed some of the penile shaft off of this area, the erection now will be more like in this direction. Okay, because patients ask, what's the changes? If you're going to do a release, is it going to do anything? Well, one thing it's going to do is it's going to change your erect angulation. Okay, but that's how we get the length out of this. That's important. All right, so I want you to understand that aspect of it. Now, let's talk about how do we keep this? How do we keep this here? What prevents this from scarring back? Right, forming scar tissue, because that was a major problem over the years. You have this release done, and all of a sudden, you appear longer, and all of a sudden you get shorter again. Okay, you get shorter again. Things kind of stick back or glue back. What we do here is that when we take the penile shaft, right, and elongate that so we're longer in the erect state, we put a spacer here. Okay, it's an implantable device, very simple. Silicone material. We put a spacer here. It prevents the shaft from reattaching. That's the idea. Because without that, the chances are less that this will stick or stay like this, okay? And the chances are that this will scar back to some degree. So it's important to put a spacer. After we put a spacer, we put a few stitches up on top to close everything, and that's it. That's how that works, okay? We've done many releases. Now, we've gotten an inch on many of them. Some we've gone more, and some we've gotten less. Okay, it's hard to predict what your result is going to be because if your pubic bone, for example, is very shallow. For example, let's say you only have this much on the pubic area. There's only so far I can go down to take. Okay, so if you, let's say someone with a very long extension onto the pubic, like the penile shaft goes way down here. This is the visible part. But if it goes way down here, wow, I might be able to get more than an inch and so forth. So it depends on your anatomy. So we had various or variable results due to that anatomic issue. But in most cases, getting an inch is not that difficult. But again, the anatomy is going to dictate that. Other issues would be in the beginning of the procedure, we noticed that sometimes the results are minimal. And we say, how can that be? We just, we took the penile tissue down, we put the spacer in. So why would it be that? Why would we have a result like that? And that's because there might be some swelling. When tissues, when you're doing some work in that area, it might have some swelling and inflammation. So that might kind of restrict things a little bit. That's why I tell my patients, we're going to do measurements from month 1 through 6. So after 30 days, then we're going to start measuring erect length. Then we'll go to 60 days and 90 days and so forth until all that inflammation kind of settles down. Your body gets used to the spacer, right? So everything, because the spacer also has to encapsulate. Your body has to entomb it and encapsulate it. So that's a process of 2 to 3 months, potentially. Okay, so we're not going to throw in the towel, so to speak, on your erect length results until we wait about 6 months. Okay. Now let's say you had the treatment done today. Okay, so you come in today, and what we're going to do is we make a simple minor incision into the pubic area. I do most of the work even with my fingers, but the dissection, when you do it with your fingers as opposed to with a scalpel, is less trauma, right? Less trauma, almost no bleeding or anything. So we just put our fingers in there, dissect the ligament, and then put the spacer in. I mean, it's that simple. I mean, there's no other way to describe that. But again, the point is the results depend upon your anatomy. Also, if you have a reaction to the spacer, right? It is a foreign body. It's common implantable material, silicone. We use it for breasts and all parts of the body. We put this type of material in and use. But if you have a reaction to the spacer a little more than usual, it might cause a little hindrance on your erect length, right? We've noticed that. But that doesn't happen too often either. Now, another risk, and this is with any kind of procedure, surgical procedure, anytime you cut the skin, no matter where it is infection. Okay? Now, if there's an infection, we have to be cautious because we're going to, of course, give antibiotics. But if the infection is close to the spacer, okay, and this we had to do a couple times, if the infection is close to the spacer, we have to remove the spacer, let it heal, and put it back in later. Okay, so there's remedies to all these issues. Of course, infection would be the most troublesome in the sense that we would have to potentially do it over, but we've done that, right? Patients want to have this done, and we're willing to do what it takes to make this happen for you. Okay, so the results, again, basically a ½ inch to 1 inch is what I tell patients to expect. Of course, I always push towards the inch. If I can get more, I'll try. Okay, we always do that. Now, just to mention the sleeve for a moment. When you do both of these, okay, when you do release and the sleeve, they work synergistically, okay? We're going to talk more about the sleeve in another video, but when you do both of them, it appears as though, even though the sleeve is primarily for flaccid length, release is for erect length, if you put them together, okay, you do the release with the spacer, you do the sleeve, extending out the penile shaft. They seem to work well together where we can get not only flaccid length with the sleeve, not only erect length with the spacer, but a combined increase of greater than 1 inch in erect length, and in addition to sometimes greater in flaccid, just by the sleeve itself. So in other words, when you put two together, you're getting more increase on the erect length and more increase on the flaccid length. That's that synergistic effect, okay? The results have been very good. We always try to improve, always, along the way. We've had made some modifications to the device to strengthen it and to modify it to, obviously, just to make it better, okay? And we're at the point where we have an optimal device. It works very well. We're excited to provide this to you and so forth. So look into it. If you have any questions, of course, you can email us about it, okay, or call the office. We can give you some information. Also, we're going to provide information on our website, loriamedical.com, and so forth. But info@loriamedical.com goes to me. So if you want to email me directly about it, you're welcome to. Okay, so if you have any questions, send them over, and we're looking forward to seeing you in our office.